Hello, everyone. A very warm welcome back to Season 2 of the Doc Talk podcast, your go-to place for no-nonsense, evidence-based health information for families. I'm Dr. Shazma Mithani, an ER doctor in Edmonton.
And I'm Dr. Sheila Wijayasinghe, a family doc tuning in from Toronto. So Season 2 is officially here, Shaz, and we could not be more thrilled to all of you who are joining us today.
Absolutely. Season 1 was so much fun, so we had to come back for more, of course. We had a total of 18 episodes in Season 1, so if you're new here or you just want to refresh, be sure to check those out whenever you can and wherever you get your podcasts.
And we did so many great topics last year, Shaz, that were so fun to explore and deep dive into. And this year, we have so many exciting things that we're building upon based on what you, our listeners, have sent to us. So we're really excited about this season.
And for this episode, because it's back to school season, it always brings a tsunami of coughs, fevers, and itchy scalps. So we thought, let's start there today.
Definitely something that I'm bracing myself for, Shaz. This is the time of year that we kind of are preparing ourselves, getting everything ready. So we want you, our listeners, to be ready just alongside us as two moms, two docs. This is what we do. This is what we see. And this is what we want you to be able to protect yourself against, but also know what to do when they inevitably do happen. So today we got a great listener question that frames today's conversation perfectly.
Hi, Dr. Shazma and Sheila. Lindsay here. Every September, I feel like my kids are constantly sick. It's overwhelming trying to figure out what's worth worrying about, what's contagious, and what I should actually keep in my medicine cabinet. Can you just break it down for us?
Oh, Sarah, we feel you. September is basically a viral boot camp.
Oh, absolutely. This is like my most dreaded time of the year, to be totally honest with you, because I know that as my kids go back to school and like start doing more activities and sports, that they're just exposed to so many more things, which means that it is a time of like heavy viral season. So that's why we're going to cover some of those big ones for you guys today. So we're going to talk about the flu and other respiratory viruses, lice, hand, foot, mouth disease, and gastro. And then we're going to share at the end of the episode our must-have medicine cabinet checklist.
And because you asked about what's worth worrying about, we're also going to weave in the latest guidance on vaccines and other ways to protect yourself. So if you're making decisions based on evidence-based guidance.
So let's start with the heavy hitter, flu season, and how to prepare for it. Here's the thing. For me in the emerge, or even just in like my day-to-day life, people talk about having the flu and they almost like conflate that with a common cold and kind of interchange the two. But influenza is not actually just a bad cold. It is much more severe and can have more severe complications than just like a run-of-the-mill cold virus is. It often hits pretty suddenly with a high fever, body aches, chills, headache, extreme fatigue, and a dry cough. Kids in particular can also have vomiting and diarrhea. So these symptoms are typically a lot more severe than what we see with just our like run-of-the-mill cold viruses.
Totally, Shaz. You know, we see this often, like the common cold and other respiratory illnesses generally tend to have milder symptoms, like you said. So they're slower onset, runny nose, mild fatigue, a bit of a cough sometimes, occasionally a fever. But they are confused often as something, but they're very different things. The flu is caused specifically by the influenza virus, and it can have much more severe symptoms and a higher risk of complications.
And I think it's important for our listeners to understand what they can do at home to help manage those symptoms. Whether it's the flu or influenza or a common cold, these are both viral infections. And so they don't need medications like antibiotics, but there are some things that you can do at home to help manage these symptoms. So things like acetaminophen or ibuprofen can help with two things, the body aches, but also the fever, and can help you or your children feel better. In terms of general management of symptoms, making sure that you're staying well hydrated. So either with water, soups, popsicles, honestly, whatever works, especially for kids to keep them hydrated and getting fluids in. And lastly, of course, let your body get some rest. Keep kids home from school. If you yourself are unwell, stay home from work, not only to prevent the spread, but also to help your body recover, heal, and regenerate.
And it also goes back to all the preventative things that we talk about, like hand washing, staying home, like you said, Shaz, if you're not feeling well, which can be difficult, we understand when you're working, but these are the ways that we can limit the spread of these sorts of things, especially when we hit flu season in the next couple of months. You know, red flags to look out for that I tell my patients all the time, the things to look out for are, listen, is your child or yourself, are you having trouble breathing? Are they tired? Do they seem more tired than usual? Are they dehydrated? Are they decreased urine output is a big indicator for us looking at dehydration, like your hydration status, and do they have a persistently high fever? If these things are happening, it's important to call your healthcare provider to seek out support, because we want to make sure that your kids aren't getting some of the complications or dehydration that can have later effects as well.
Yeah, absolutely. I think it's really important to highlight those red flags, because that is also what, like when patients, either adults or kids, come to see me in the ER because they're concerned about their symptoms, they're often coming in for those reasons. But even if they end up going home after some either reassurance, some general management, or some hydration, those are the exact same things that I tell them to come in for. If they notice those things at home, that's when you should come back to the ER to see a doctor. Now, I want to switch gears a little bit, specifically staying with influenza. It's important for our listeners to know, especially our Canadian listeners, what the National Advisory Committee on Immunization, or NACI, recommends for flu vaccines this year. So all people over the age of 6 months should get an annual flu vaccine. If your child is between the age of, or if they're getting their first flu vaccine at the age of 6 months, they actually need 2 that year, 1 month apart. After that first influenza season, it's 1 shot every year after that. And in older adults in particular, it's important to also know that there's actually a different formulation that is available for adults over the age of 65, because that is a population that is at much higher risk of complications from influenza. And so there is actually a different vaccine with a higher dose and a different formulation that is much more effective in this older population. So it's important to talk to your pharmacist about that. And if you don't have access to it, the other dose, like the standard dose, is still okay. But if you are in a place where you can have access to the enhanced vaccine, it's important to ask for that if you're over the age of 65.
Also important for our pregnant patients to consider getting vaccinated, because that's going to give protection to your newborn when they arrive. A big thing that I talk about in my practice when patients ask, do I really need the flu shot? I'm really healthy. Listen, the vaccination not only protects just your child, but everybody around them. So if you have people in your life who may have asthma or respiratory diseases like emphysema, or are in an age group that is higher and higher risk, or are younger kids as well, including infants who are too young to get the vaccine, vaccination is so critical, because this is how we decrease spread to those individuals who are higher risk. So if you're not doing it necessarily for yourself, you're doing it for those around you. And also, just not to get the flu is such an important thing, because it really puts a damper on our lives. And always, as I mentioned before, simple measures like hand hygiene, masking when sick, staying home when symptomatic can also reduce the spread.
And for our listeners, there was an episode in season 1 on respiratory viruses where I actually talk about my youngest child having to be rushed to the ER because of influenza. So this is something that is such an important thing. Even people who are healthy can get severe complications from influenza. So please get your family vaccinated. So let's shift gears. Next up is lice, that dreaded email, or that dreaded kind of, sign when you walk into school of there's a case of lice in the class. I think it's like every parent's nightmare.
Absolutely. When our WhatsApp group goes off on lice, it is like 40 messages in a row of everybody panicking, because lice is it's not really dangerous, but they're highly contagious and annoying, and they can cause symptoms like itching, which is really a reaction to, like an allergic reaction to lice bites. And sometimes you can even see the small nits. It just has this gross factor to it that I think we all kind of cringe at. Whenever we get the thing, I always start itching my own head when I see the WhatsApp group thing, and just kind of like the kids get home and I'm like frantically looking at their hair and trying to figure out. We're really fortunate. I want to knock on something right now. We have not had lice, despite having several lice outbreaks in our class. But this is something that's really, really an important one that affects people quite a bit.
So we actually had lice in our household about a year ago. So I basically feel like I'm an expert on this now. When you talk about the itchy head, though, even when I see patients at work who have lice, or if it's a patient with bed bugs, no matter how much PPE I have on, for the rest of the entire shift, I'm itchy everywhere. It's just that psychological aspect of it as well really gets you. So thankfully, when lice entered our household from school about a year ago, we caught it early. And it didn't actually spread beyond the one person in the house. And so I actually do have a detailed 1-pager on how to manage lice that we are going to include a link for in the show notes. But just briefly, treatment is with over-the-counter or prescription lice shampoos. You can typically start with over-the-counter encounter first. And then getting one of those lice combs, so those fine tooth combs that are like have the bristles really close together, that can not only help comb out the lice themselves, like the live lice, but it can remove the nits or the eggs, and those attach really firmly to the hair shaft. So having this special comb, it's really important to be able to get those nits out. And you want to repeat that every 2 to 3 days for a total of 2 weeks. In terms of cleaning regimens, washing beds, hats, hairbrushes, upholstery, it's important to like vacuum those things as well. You don't need to bag everything for weeks because thankfully lice don't actually survive off the scalp for very long, just for really a few hours.
Yeah. And I think a big question that parents will have is like, when can kids go back to school? They can go back after their first treatment. No need to miss out on an entire week. We do one treatment, but if you're finding, we generally do a second treatment if it's still persistent. So no need to miss the entire week. You can get back to school after that first treatment.
Yeah. And I think an important piece to know, the reason that we do 2 treatments is that the first treatment kills the live lice, like the actual live bugs, which means that when then the kid is allowed to go to school, they're not contagious because there are no live lice anymore. That's what makes it contagious. But the second treatment is to then, if any of those eggs were not kind of managed in that first treatment, it's to kind of kill a second round as well. So that's why it is important to have those 2 treatments.
Absolutely.
So switching gears again, let's talk about hand, foot, and mouth disease. This is something that I'm going to knock on wood here again, because it is not something that we've had in our household yet, but boy, do I see it a lot in the ER, and certainly get notes about outbreaks at our out of school care and school as well. So hand, foot, mouth disease is a viral infection. It's usually caused by Coxsackie virus. It spreads very rapidly in daycare and early school settings. We typically actually see it around back to school time because it tends to spike in late summer and early fall. So right around that back to school time, but you can still see outbreaks throughout the year as well.
Yeah. So I was in clinic this morning. I had 2 cases of hand, foot, and mouth that came in. And so we were reviewing this with the families. Super common. Again, one of those things that when the WhatsApp group goes off about hand, foot, and mouth, you know that you're in for like checking out your kids, examining more than you usually do, just to make sure that they don't have that, because it is highly contagious. The symptoms of hand, foot, and mouth, as many of you know, is that you can get a bit of a low-grade fever. You can have a sore mouth because you have these open sores that are quite tender when you eat or drink anything. And these are basically small red spots or blisters that you can have on your hands, feet, or inside the mouth. Now, so for some people, Shaz, I'm sure you've seen this, like it's a bit of an atypical presentation where the kids I saw this morning, one of them didn't have anything in their mouth. They only had it on their hands and feet, which actually was nice because it spared them. They were able to still eat and drink. Whereas I've seen really significant cases, I'm sure you've seen it, where you might have had to even rehydrate kids because they're so uncomfortable having these blisters in their mouth because they refuse to drink fluids. And so that's the case that you may need to look out for those signs to look out for.
Yeah, and that's a really good point, because for me, when I have parents bringing their kids into the ER, it is specifically for the mouth lesions, because they can be really sore. Like you said, kids will refuse to drink and to eat. And, as I've said before, I'm never too worried about kids not eating. That's fine. Humans can go days and even weeks without eating. It's just hydration that is really, really important. You can only survive a couple of days without fluids. So really, really important for hydration. And so in terms of management steps, focus on that hydration. So whether it's cool drinks, ice chips, popsicles, whatever your child will tolerate, it's important to give pain management before. So if you are noticing that you're trying to hydrate your child and they're really refusing things, use a dose of either acetaminophen or ibuprofen first, wait maybe 20 or 30 minutes to help provide that pain relief, allow the medication to kick in, and then try hydration again. And then, of course, we don't want this to spread beyond within the household or even outside of the household. Adults can still get hand, foot, and mouth disease as well. So it's important, lots and lots of hand washing and hand hygiene to reduce that spread.
Yeah, it can be really severe in adults, actually. If you haven't been exposed to it before, I've had some cases where patients, again, have had to go into the emerge because they haven't been able to hydrate themselves well. For smaller kids, for pain relief, sometimes I always have on hand even like a rectal form of acetaminophen or ibuprofen, just because they may not be able to tolerate orally to get that in, or small doses, right? So you get the liquid formulation, like infant formulations are more concentrated, so it's smaller volume of liquid, and then little bits at a time might be helpful to get it in. in before you try to support your kids with hydration as well. So hand, foot, and mouth is generally considered self-limited. We don't treat it. We do supportive care, as you said, Shaz, in terms of fluids and pain management. Kids tend to recover in about a week. We think that once the initial blisters have scabbed over, they're less contagious and are able to go back to school. That's a big question for daycares and otherwise. The red flags to look out for: if they're not able to keep their fluids down, they can't hydrate well because of that pain, or they're incredibly tired as a result, please do contact your healthcare provider or go in to get help.
Mm-hmm. All right. So next up is gastrointestinal bugs. So vomiting and diarrhea, most commonly caused by norovirus, but lots of other viruses, including influenza, can cause these symptoms as well. These viruses tend to be highly contagious and can move quite quickly. Again, we're talking about all these like dreaded, text messages or school warnings, or even just like chatting with other parents. This is another one of those highly contagious and fast moving illnesses within classrooms and kind of childcare settings as well.
Yeah, and the symptoms can come on really suddenly too, right, Shaz? Like the sudden onset nausea, the vomiting, the watery diarrhea. Sometimes they can get a low-grade fever. Because the kids aren't holding on to their fluids in the same way, they can be pretty tired and irritable and show signs of dehydration. So we really want to, while we can't necessarily do anything to treat, like antibiotics aren't something that we use in this situation, we really focus on supportive care and hydration as much as possible.
Mm-hmm. So in terms of management tips, again, these are like everything that we've talked about so far today are not things that need antibiotics because they are viruses. So focusing on hydration. So oral rehydration solutions, an example of that would be Pedialyte or any other kind of similar oral rehydration drink for kids. Adults can use those pediatric drinks as well with small, frequent sips. If you have a child or yourself who's really thirsty, it's hard because they want to just like chug back a whole cup of fluid, but that can actually increase the risk of vomiting. So we really recommend small, frequent sips to try to keep a little bit in the stomach, get that absorbed before you're putting more in. And so it really does allow for better fluid absorption and hydration. The other thing to think about is diet. So, like I had said earlier, I don't really get fussed if kids aren't eating. It's really important to focus on hydration. But if they are hungry for food, there aren't really any specific limitations on types of food that they can eat, just whatever they have an appetite for. You can start with lighter foods as tolerated, then kind of go increase from there. So things like crackers or toast might be just like a good introductory food, and then increase from there depending on what their appetite asks for. The one thing that we tend to ask parents to avoid is sugary drinks because that can make the diarrhea worse. So focus more on like balanced electrolyte solutions for fluids. And then lastly, I always get asked if there are any medications that parents or kids can use for gastrointestinal illnesses. And we really say not really, unless they're having some pain or having a fever. You can use things like ibuprofen or acetaminophen, but we don't give antidiarrheal medications in children because it can actually have some complications if we use those in kids.
For sure. This is where I stock our freezer with some Pedialyte popsicles just to have as a backup in these situations. They're a little bit easier when kids are sucking on them. They just gives them a little bit of fluid at a time. So you're not getting into that situation, Shaz, as you mentioned, where if you give too much fluid all at once, it's because they're really thirsty. It is a controlled way of giving them fluid. And that can be really helpful as well. Mm-hmm. The red flags to look out for, we always talk about red flags, Shaz, in your office. When I send patients home after I see them, I'm like, if your child is not urinating for several hours at a time, about 8 to 12 hours, they haven't peed, or they're having persistent vomiting, or there's blood in their stool, and you know your kids best, if they're really, really tired and they're not acting themselves, kids go really fast into dehydration. They can tip really quickly into a more serious situation. Don't hesitate to come in. We'd much rather you come in to get that support, Shaz. I'm sure that's the message that you give kids and families in their merge.
Absolutely. So if any of those things that Sheila mentioned do occur, that is a very good and valid reason to come and bring your child to the emerge to get checked out.
So we're going to put it all together now with what we have in our own medicine cabinets, basically, as 2 moms, 2 docs. What do we have in our medicine cabinet so that you are ready for back to school with just this list that you can write down, keep handy, and keep it stocked? Okay, so I'll go first. The thing that I always have in my medicine cabinet is
acetaminophen and ibuprofen for fever and for pain. So I make sure that I have weight appropriate versions of this. For when my kids were younger, I always had like the liquid version because that's what they were able to take. My oldest, she's now like 9, almost 10. She can swallow pills sometimes if needed, but there's also chewable tablets that you can get for both of these formulations. And those are a lot easier for like travel as well when you're taking things with you. So we have both liquid formulations and chewable tablets of acetaminophen and ibuprofen.
Yeah, that's first on my list as well. Next up, we actually have the oral rehydration solution. So I have like the powdered version, but I also have the popsicles in the fridge because then those are easy. You can store the popsicles in your cabinet and then throw them in the freezer if you need them. But that's a really helpful thing to reach for. There are oral rehydration solutions that you can formulate yourself, but it's kind of easier if you can manage to get these oral ones that are ready-made, because in those moments, you just need to make things easier for yourself.
Yeah, and the nice thing I like about those is like having the powders, they have like a stable shelf life or a longer shelf life where you can just mix them up if you need to. And same with the popsicles, you can like freeze them as you need them, right? So it's nice to have that option. The other thing that I always make sure to have is a reliable thermometer. So when my kids were younger, kids under the age of 1, we recommend having a rectal thermometer because that is the most accurate way to check a temperature. As kids are older, so kind of 4 or 5 and higher, the next most accurate way is doing an oral temperature. But that's really age dependent because you really have to make sure that your kid can hold the thermometer under their tongue for long enough to get an accurate measurement. And so making sure that you have a thermometer at home so that you know when your child has a fever, which is over 38 degrees Celsius, or when, and then when to give fever medications for them to make them feel better.
For sure. Not so much related to what we're talking about today, but always also in our medicine kit is that we often have like an hydrocortisone or an antihistamine type of cream for rashes or post-bite that may happen. I also have an antihistamine for kids. Benadryl has fallen out of favor because it's quite sedating. So getting a non-sedating antihistamine oral option is really helpful to have on hand as well. Again, that comes in liquid forms for kids, but also in pill forms that are chewable, or if your kids are swallowing, that's a great option to have.
Mm-hmm. It shouldn't surprise you to know that I now have a lice treatment kit in my medicine cabinet at all times. So last year when we had one of our children have lice, it was like, of course, first thing in the morning as they're like getting ready for school. And I'm like, we have nothing. We didn't have the comb. We had nothing. And so I'm like rushing to get ready for work. I set my husband out. I'm like, you need to go to the pharmacy and just like get the lice things. So we now have, and then we, did the first treatment. We actually treat everybody in the household and then did a subsequent treatment a week later. So now we have that stocked in our medicine cabinet so that it is like, if this happens again, we're ready to go right away. We have the comb, we have the lice treatment. We're ready.
Well, you know what happens when that WhatsApp list goes out, like the message goes out that everybody goes to your local pharmacy. And so that's happened to us before too, where we run to the pharmacy and you see all the other parents from your list there buying them as well. So you might want to have one. The other thing we have in our cabinet is bandages and antiseptic wipes, just in case of emergency cuts, scrapes. Those things happen very much in the first part of school year as well.
Mm-hmm. And then a few other things, especially when my kids were younger, we always had a good nasal suction device. So I like the ones in the hospital. We usually give out the bulbs, but the bulbs they don't really provide a lot of suction. There are lots of brands now where it's basically you put one end into your mouth, then there's a tube and the other end goes in your child's nose and you suck. There is a filter so the boogers don't get in your mouth. But those actually provide really effective negative pressure to get those boogers out. So having a saline spray or saline drops to kind of put drops in the nose first and then doing the suctioning is really helpful if your younger kind of baby or younger toddler has nasal congestion because they aren't quite old enough to blow their nose yet. Making sure that there's a humidifier that can help with nasal congestion and coughing at nighttime as well. Those are kind of additional things that we always have on hand when the expected, I shouldn't even say the unexpected because we know the colds are going to happen, but when those respiratory viruses come into the house.
Yeah. And last season, when we talked about cold and flu season, we did highlight a study that showed that when saline rinses are used, it decreases the duration of symptoms and the transmission to other people. So that's really important. So we do have a saline rinse that we do for our kids. It's like a mist, and that's really helpful as well. Cough syrups, people always ask me about, should we have a cough syrup for our kids? it is not safe to give your kids cough syrup under the age of 6. Health Canada has put out a statement of that. What we do use that has been found to be equally effective is for kids over the age of 1 is honey in water. So we always have honey on in our medicine cabinet, but we have it available to help soothe the throat as well during cough and cold, like cold and cough season, cold and flu season.
And the only thing I'll add there is that even though, like, so when you say cough medicines, they're dangerous under the age of 6, they're actually not really effective even over the age of 6 and into like teenagers and adults. So there's been a lot of data to show that in kids and teenagers, cough medicines are not effective, and they're like barely effective in adults. So it's not something that we keep around for that reason.
So that's our list of everything that go in your medicine cabinet. So not a long list, but the key thing is it uses as an opportunity to check your expiration dates every fall, because it's not that they become dangerous necessarily, the medication, if they're expired, but they may not be as effective. And there's nothing worse than reaching for a medication at 2:00 in the morning when your child may be having a fever or having some pain due to the flu, and to find it expired, because you want the most effective option. So please do check your expiration dates every fall, because you want a medication that's going to work for you as much as possible in those moments.
So as we kind of wrap up, I do want to make sure that our listeners are armed at the end with important notes on when to keep your children home. And so for me, the quick rule of thumb is if they have a fever, vomiting, diarrhea, a rash, or they are generally too unwell to participate, keep them at home.
Yeah, and if it's just a runny nose, that's probably fine. Even a mild cough, that coughs can last for a long time after the initial infection happens. Use your judgment. Your kids. When you're in doubt, call your school nurse or healthcare provider, because we're here to support you through making those decisions as well. So we're going to end on our little quick true and false segment on this. We like to do this. It became quite popular last season. So Shaz, are you ready for our wrap up of true or false?
Let's do it.
Okay. So true or false, the flu shot can give you the flu.
This is unequivocally false. This is a very, very common misconception, but I want to make sure that our listeners know that the flu vaccine cannot give you the flu. Now, it is common to get some mild side effects after the influenza vaccine, so mild aches or a sore arm. That's because the immune system is doing what we want it to do, which is building up protection. There are a lot of people that come in and say, I got sick immediately after I got the flu shot. And there are a few reasons that might happen. One, it could be that you did get the flu, but the vaccine does take 2 weeks to work. And so you didn't have any kind of adequate immunity built up to it first. The second thing is most likely is that you got another respiratory virus that's not influenza. So it's important to remember that the influenza virus or the influenza vaccine only protects against the influenza virus. And so there's tons of other cold vaccines that can infect you that the flu vaccine is not going to protect you against. Okay, so next up is true or false. Head lice can jump or cannot jump from one kid to another.
So true. They can crawl, but they don't jump or fly. So transmission generally happens directly from head-to-head contact or by sharing things, which kids always do. I tell my kids all the time, please do not put on somebody else's hat. Do not use their brushes. Sometimes my daughter will want to take her brush to school. I'm like, please don't do that, because I'm throwing that out if you do that, because anytime they're sharing something like hats or brushes, it's direct contact like that. So they're not jumping, even though it feels like they can. They just crawl.
Mm-hmm.
Okay, here's our next one. True or false, hand, foot, and mouth disease is dangerous?
So false, or mostly false. So although it looks very dramatic with those blisters, the disease tends to be quite mild, but there is a significant risk for dehydration like we talked about. And so the only potentially dangerous part of that is the risk of dehydration if kids refuse to drink because of that mouth pain and those blisters in and around their mouths. Okay, last one. True or false? It is a good idea to keep acetaminophen and ibuprofen stocked in your medicine cabinet before school starts.
So true. You don't want to be running to the pharmacy in the middle of the night when a fever hits. You want to be stocked up. So please do keep that list handy and make sure that you're covering yourself. Make things easier for yourself.
All right. So that's great. 2 trues and 2 falses. That's a nice balance today for our listeners.
And hopefully some peace of mind as you get ready for back to school.
So that wraps up our first episode of season 2, Back to School Illnesses Demystified.
We hope this gives you some practical strategies to manage the things that, as you said, Shaz, these are some inevitabilities that are coming our way in the school season. So you're ready. You have a stocked medicine cabinet. You know what to do when these things happen. And most importantly, when your kids are okay to go back to school.
Absolutely. Thanks for joining us today on our first episode of season 2 of the Doc Talk. Please be sure to subscribe, rate, and share the Doc Talk podcast with fellow parents.
And a reminder that the Doc Talk is for general information purposes only. This podcast is not intended to replace medical advice from your doctor. While we are doctors, we are not your doctor. Always speak to your own healthcare provider for questions related to your personal health needs. And be sure to follow us.
And a special thank you to today's episode sponsor, Figs. So obviously in our line of work, you kind of live in scrubs. And if you follow us on Instagram, you probably already know this by now, but we are obsessed with Figs scrubs. They're super comfortable, breathable, durable, and they actually fit well, which is, for me, a massive upgrade from those horrible itchy scrubs that were status quo in the hospital for so long. They're super cute and stylish, and they just feel good when you're in them, you know?
Yeah, totally, Shaz. Like you said, we're obsessed with them. But you know what I love most about Figs is that they just get what it's like to work in this field. It's not just that they know what we need, like 7 pants pockets to carry all our stuff around on shift. They've also built this incredibly supportive community of people who want to have important discussions and make real connections with other people who work in healthcare. I've been to a couple of events they've done, and it's so refreshing for a brand to show up in such a real way. And you guys, if you're not following them on social media, the memes. They are very funny and very relatable. If you work in healthcare or know someone who does, Figs is it. And right now, if you go to wearfigs.com and use code FIGSCA, that's FIGSCA, you can get 20% off your first order. That's wearfigs.com, code FIGSCA.